Hi, I'm Todd Hockenbury. I'm Assistant Clinical Professor of Orthopedic Surgery with UofL Health. Initially, I was interested in veterinary medicine, and I ended up going to West Point for undergraduate training, and that really wasn't an option for me to pursue veterinary school. But while I was there, I was a gymnast and broke my ankle and got introduced to orthopedics and kind of had an interest in that part of medicine, and then that became available for me to pursue later on. After I graduated, I was able to get a scholarship through the Army to go to medical school here at University of Louisville. I was stationed in Germany, and then I actually spent time in a MASH unit in Yugoslavia, in Croatia during the breakup of Yugoslavia. I worked with the United Nations and took care of patients from 25 different countries working out of a tent. That was fascinating work. Then I came back to Fort Knox and was chief of orthopedics at Fort Knox. And I even got to go to airborne school and do the Army thing. So I spent 20 years in the Army. So I got out of the Army, and then that's when I did my foot and ankle fellowship. So I did general orthopedics for 6 years. And then since 1997, I've been doing primarily foot and ankle surgery. I am an adult reconstructive foot and ankle surgeon. So I deal with people who have arthritis of their foot, who've broken their ankle or their foot, and now 3 years later they can't walk. People who have diabetes and have problems with developing sores on their feet or have developed bad fractures due to their diabetes. I do sports medicine like ankle arthroscopy, tendon tears, and things like that. So anything to do with an adult that has a foot problem. I treat patients about 12 years and older. I hope that my patients think that I listen. I see a lot of patients who have been seen by other doctors and have had other surgeries by other doctors and they didn't turn out very well. So they come to me, and I hope I am able to listen to their problems, do a good examination, and make their problem get better. My niche is ankle replacement surgery, which is not a very commonly done operation. I started doing that operation in 1999, so I have about 22 years experience of doing that procedure, and I've done probably close to 700 of those over the last several years. And so I see a lot of those patients who benefit greatly from that operation. I'm a runner, so I've run several marathons. I do that with my kids. We have a lot of fun doing that. I play the piano, so I'm still working on that and taking lessons still to this day. And finally, I love to bake cookies. So I have a special German cookie called a Springerle cookie that I make every Christmas that I give out for presents, and people really enjoy those.